Planet Dolan. Are teenage girls supposed to grow a beard? What happens if you have crucial vitamin deficiencies? We count 15 things that you should get checked out by a doctor right now. I'm Danger Dolan, and today I will be your narrator.
Number 15.
Lady beards. Unfortunately for a lot of young women, unwanted body hair is a fact of life. When puberty hits, hormones make your body do some pretty wacky things for better or worse. Facial hair is common, but if you find that you got thick hairs growing from your face at 16 and you happen to be a girl, you should definitely talk to your doctor. You might have a hormonal disorder called PCOS, which is caused by bombardment of testosterone. PCOS can have serious consequences on your body, so don't be shy about getting it checked.
Number 14.
Rashes. Being aware of the changes in your body is something you should take seriously. Something as simple as a rash can be signs of more drastic things going on in your body. Most rashes are not life-threatening, but sometimes they appear at the same time as other symptoms, which could be a problem. If it gets worse, starts to spread, blister, or you suddenly get a fever, it could be a sign of a serious infection. Googling your symptoms never ends well. Just see a doctor.
Number 13.
The common cold is a frustrating condition, but it's important to know the signs if it escalates into something more sinister. The color of your boogers is a very simple way to figure out what's going on inside your body. Viruses like colds and flus are not treatable with antibiotics, a common misconception. When your boogers are bright green, then you're likely dealing with an infection, in which case you should ask the doctor about antibiotics. The same can be said about the color of any discharge from anywhere else in the body, of which we are all highly aware.
Number 12.
Sores that won't heal. One of the many wonders of life is the ability to heal wounds. Skin can generally do a pretty good job healing cuts, rashes, and lesions. But what does it mean if your wound just won't heal? Aside from a potential infection from foreign bodies, you should check for circulation issues and side effects from medication. Treatments that involve steroids, anti-inflammatory, and estrogen supplements can impede your body's natural ability to heal. Your GP is the best person to help narrow down any potential causes, but don't be too worried if it doesn't heal itself within 5 seconds like Wolverine. Turns out you're not a superhero. Not yet.
Number 11.
Thyroid, the gland in your neck that weighs under an ounce, can be a commonly overlooked source of bodily ailments. Thyroid disorders are more common in women than men, and when the hormone-producing gland isn't working properly, it can really mess you up. Symptoms include copious sweating, depression, fatigue, and sometimes just a swollen neck. Thyroids regulate a series of important systems in your body, and when left untreated can affect your heart, bones, and organs, on top of impeding your daily life. I personally know plenty of people with thyroid problems, so yeah, definitely get it checked out.
Number 10.
Skin. Cancer is a horrible affliction, and luckily it can help to prevent certain types. Melanoma is a cancer of the skin, usually characterized by changes in existing moles or appearance of new ones. The cause is almost always sun exposure. It is important to keep an eye on moles that change in color, texture, size, or feel. Take photographs of your spots and compare them every few months. Doctors have technology that can test any suspicious freckles or moles, so if you notice anything different, tell them. The best prevention method is protective clothing and sunscreen when outdoors. I personally have lots of moles on my body that just look super funky, and the doctors are always like, "Is that always been there?" I'm like, "Yeah," and they're like, "That's fine then." But that weird green golf ball sized thing that just grew on your neck, get it checked out, mate.
Number 9.
Blood and cholesterol. High blood pressure is the leading cause of strokes in men, which can be lethal. Every 3 to 5 years, men over 20 are recommended to have their cholesterol levels tested by a doctor. A high cholesterol level can cause all sorts of cardiovascular issues, such as heart attacks and stroke. Men over 50 are advised to get checked once per year. Changes to your diet and an exercise plan are often prescribed methods of cutting your cholesterol levels down. Simple test might save your life.
Number 8.
Your family. There is one simple test a doctor can do without even lifting a finger. A lot of medical conditions are caused by the genes your parents passed down to you, including lethal ones. Telling your doctor about your family's medical history can give them insight into any potential problems your body may be susceptible to. Hereditary cancer, diseases, heart attacks, and mental health disorders are a few to be aware of. Your doctor should be able to do some further tests if they suspect you might be at risk.
Number 7.
Your junk. It might be an awkward conversation to have, but asking your doctor for an STD screen could save your life. When a person acquires a sexually transmitted disease, they often get uncomfortable symptoms in their parts, including sores, redness, itchiness, discharges, or lumps. But sometimes there are no symptoms at all. This doesn't mean it will go away by itself, and you can still pass it on to the next person you engage coitus with. Prevention is the best cure for STDs, but if you've had unprotected sexy times, go get checked for your health.
Number 6.
Your habits. If you're one of those people that works too hard, parties too hard, or generally lives a life of excess, you could be destroying yourself from the inside out. Healthy people are always going on about a healthy work-life balance. One of the biggest problems about our high-stress lifestyle is that you could be exacerbating mental health problems, meanwhile thinking that everything is fine. Your mental health is just as important as your physical health. Talk to your doctor if you don't feel 100%.
Number 5.
Liver enzyme. Drinking's fun, makes you feel invincible. But that couldn't be further from the truth. When you drink excessively, your liver becomes inflamed from trying to keep you alive. That inflammation can cause healthy liver cells to be replaced by scar tissue. Drugs will also batter your poor liver, which is responsible for more than 500 functions in your body. A liver function test will reveal any damage it may have sustained and is checked by a blood sample. Alcoholism is serious and can kill people. Having a drink once every so often like me is fine, but please don't drink like 8 in one night. That's dumb. That's dumb. That's dumb. You're dumb. Stop that.
Number 4.
Your twinkle cave. We're getting pretty lucky that we live in an age where certain cancers can be detected with a routine test. Some women are put off by the idea of the dreaded pap smear, but it's a little bit of temporary discomfort for a whole lot of peace of mind. Getting your cervix checked every 2 years can literally stop you from dying of cancer. You can always request a female doctor, and it's usually over before you know it.
Number 3.
Mouth chompers. Your mouth is a complex ecosystem of bacteria and enamel. If you don't maintain a strict hygiene regime, gum and tooth-destroying bacteria will overrun your mouth, not to mention you'll have terrible breath. In fact, if your breath smells particularly bad, it's most likely due to your teeth literally dying in your jaw. Dental procedures are enormously expensive, and brushing your teeth takes approximately 4 minutes per day. If any of your teeth change color or smell bad, go straight to a dental professional. Or just watch that episode of Ren and Stimpy and you'll just brush your teeth forever.
Number 2.
Your peepee. Looking in the toilet after you drain the old trouser snake can tell you about the health of your bladder. Normal urine should be straw yellow in color, but the smell isn't too overwhelming. If your pee is cloudy, bloody, or burns your nostrils, you should get it checked. Sounds like common sense, but a lot of people just choose to ignore the slightly awkward symptoms and hope they go away, but that just makes things so much worse. If your pee smells real bad after eating asparagus, don't worry, it's common.
Number 1.
Vitamin D. During the winter, your body might feel unbelievably drained of energy, and there might be a medical reason for this. Signs of vitamin D deficiency include prolonged depression, ache and bones, sweating of the head, and gut problems. Vitamin D regulates your immune system, which is essential during winter. Unlike a lot of other vitamins that are found in consumable food, the biggest source of vitamin D is sunshine. People with dark skin need up to 10 times more sun exposure as a person with pale skin. If your levels get too low, your doctor will almost definitely prescribe vitamin D supplements. I should know, I've had them, and so has Gooby. So guys, what's something you think everyone should get checked out by a doctor? Let us know in the comment section down below, pin a favorite to the top. This video was made possible by our fans over on Patreon. Thanks for your support, guys. That is it for this countdown. Have a good one!